Welcome to the Veterans Corner, and thank you for inviting us into your home today. I'm Greg Gagne, a veteran advocate. The Veterans Corner primary mission is to help veterans with employment, and the secondary mission is in meeting their needs by bringing employers, nonprofit agencies, and veterans together. We do this by interviewing employers, nonprofit agencies here on the Veterans Corner. So if you are a veteran or know of a veteran that needs assistance, give me a call at 315-3259. If you are an employer or a nonprofit organization who wish to participate on the show, just give me a call at 315-3259 as well. This is a free service. Let's make a difference this year for our veteran heroes. For our guest today, we have Mr. Brian Burton. He's with the Southwest Louisiana Area Health Education Center, and he is the director, and he's here today to share information about what his organization does, or rather the program that he's over. So, Brian, how you doing, my friend?
Thank you very much. It's a pleasure to be here today.
Okay.
I'm excited to talk to you this morning.
Yeah, let me take off my glasses so I can talk with you. So tell me, what's this program is about?
Well, just a quick little history and everything. Southwest Louisiana Area Health Education Center. We're a public health foundation. We're just celebrating this year our 25th year of serving Southwest Louisiana, both the Lake Charles and Lafayette area.
Okay.
And our mission is to give people the tools that they need to live healthier lives.
Right.
And so for the last 3 years, since 2013, one of the things that we've done is partner with the federal government to help with the implementation of the Affordable Health Care Act in Louisiana.
Okay.
Make sure that people have access to affordable health insurance.
Right.
Including veterans.
Right.
And so also, we have been working with our state health department over the last 6 months, preparing and mobilizing the state to prepare for Medicaid expansion in Louisiana.
Okay.
And so I'm glad to be able to talk to you today about how these two programs can affect the veterans community and services available for them.
Well, tell me about the program. I guess it's for both veterans and non-veterans.
It is. Part of the Affordable Health Care Act does a number of things, okay? I mean, the first thing that it does is it connects people throughout the community, throughout the country, with health insurance companies in their community.
Okay.
And then the second thing that it does is for those that are above a certain poverty level, it provides cash assistance to help them pay their monthly premiums. Okay. For those that are below 138% of the poverty level, which, for a family of four is about a $33,000 a year income, they have access to an expanded Medicaid in Louisiana. And so we're able to help folks enroll in that.
Okay, so with the expanded Medicaid,
sure.
Touch on that a little bit more.
Sure. January 11th, we have a brand new governor, John Bel Edwards in Louisiana. Right. The first thing he did on January 12th was sign an order to expand Medicaid in Louisiana. Right. Which meant that all people below 138% of the poverty level, so like I said, for a family of four, that's about $33,000 a year in income, they have access to free health insurance. Okay. And here in Louisiana, we have 5 different insurance companies. We have the Amera Group, Amera Health, we have Louisiana Healthcare Connections, United Insurance, and Aetna Insurance. And so there are 5 different health managed care plans that consumers that fall into that range can come in and choose which healthcare insurance company they would like to provide their, to help pay for their insurance. Right.
Because I do know that as a veteran,
yes.
Okay, I'm under Medicare automatically. Senior citizen, how's that
sound? I'll tell you, you can't tell how many people cannot wait to turn 65 years old to get access to Medicare.
Yeah. And also, since I'm also a veteran, I'm part of the VA outfit as well. Okay. So technically my health coverage is pretty well, I got good coverage.
Gotcha.
Okay.
Perfect.
But I've run across many veterans who do not even want to get involved at all with the VA system.
I understand that.
I think this way it comes into where with the expansion side, right, that they can jump into if they qualify to get subsidized or things like that. But there are people out there that needs health insurance. There's no question about that. My only argument is that when the health care argument was in debate, everybody was pushing it's going to cover everybody.
Right.
All uninsured. Well, as we know right now, it doesn't do that. There's a big shortage, but at the same time, a lot of people don't understand the healthcare system. When
the Supreme Court came in and made one of their determinations, one of the things they said is that, that yes, the Supreme Court said that the federal government has the ability to penalize people for not having insurance.
Yes, I know.
But at the same time, they also said that each state has their ability to decide whether or not to expand Medicaid.
Yeah.
And under our previous administration, the decision was not to expand Medicaid.
Right.
Which left anywhere from about 300 to 450,000 people in our state without any health care insurance at all.
That's right.
But beginning July 1st of this year, 2016, all of that changed. And so now there's something for everybody,
Okay.
And so now those 350,000, 400,000 people, they now have access to insurance.
Right.
And we've been working with them for the last month and a half now, getting them enrolled. But a lot of people still don't know about it. And, that's why we're excited to talk to you today.
Yeah, well, that's good because it's something that is needed in this area. When it comes to the healthcare providers, okay, you said something about United Health?
Yes, United Healthcare.
Okay, that's one of the majors.
That is.
Yeah. Well, I'll tell you what, this is going to kind of end our first segment.
Okay.
Okay.
Sure.
And in doing so, we'll be back in a couple of minutes. We're back with Mr. Brian, and he's going to expand a little bit more on the types of programs that are available to veterans and non-veterans. So to start off, Brian, just how does it work for veterans?
Well, I tell you, one of the challenges that or one of the consumers that we work with a lot are veterans. They're those guys that have and gals that have access to veteran services. They're able to use the veteran hospitals, but none of their costs are covered. Right. And so for that, they have to have their own insurance.
Right.
And, for those people that are above 138% of the poverty level. So, like I said, it's about $33,000 for an individual. If you're above it, the marketplace is available to help you sign up for insurance companies in the marketplace. So in Louisiana, that would be insurance companies like Blue Cross Blue Shield, Vantage Healthcare. And so what happens is based on where you are and how much money you make determines what your advanced premium tax credit is. And so that's a subsidy to help you pay it. Once you sign up and everything and you figure out how much money that you have to pay, assistance that you have, you take that and you apply it towards any of those plans out there. Okay. So if you pick a plan that is, $600 a month and, you qualify for a premium that's $500 a month, the person, all they have to do is pay $100 a month for that premium. So you pay your $100 to Blue Cross. The IRS pays the other
subsidized amount,
and together that $600 pays your monthly premium.
Okay.
But if you're below 138% of the poverty level, okay, then you don't have to pay a premium all. That is those are the folks that are eligible for Medicaid.
Okay.
And like I said, in Medicaid, what happens is it's basically free health insurance. The only thing that you may have to pay are very small co-pays for medication, and those run anywhere from as inexpensive as 50 cents a month to as expensive as $3 a month. So between that 50 cents and $3 is all the out-of-pocket that you have to pay.
When it comes to veterans, basically that is below 62.
Yeah, that's right. Well, you know,
they're out of the military,
right?
But they're just a veteran
That's
and have to deal with insurance. They're not Medicare because they don't qualify. All they got is just, they may have the VA help,
right?
But making it apply to them, these younger veterans, I think they would have a little bit more.
That's right.
Involvement with.
And that's why one of the services that we offer is navigation services. And so that is a person, we've got people all around the state of Louisiana that can sit down with the veteran one-on-one and sit there and look and see what their options are. Help you figure out what your annual income is and where you might fall and all of that, and really sit down and explain to you what your options are.
Well, that's good. That's good. Because I do know that when it comes to the veterans' health side,
right,
the younger veterans, because of lack of information.
Right, no, exactly.
And the thing is, I hate to say this, but sometimes the VA don't accept all veterans.
Right.
And you're out there on your own.
And we see that a lot, you know, that you might have access to the VA hospital in Alexandria, for example, but there's no insurance to help you cover your cost. So this is where it's important to sign up for Medicaid, you know, if you qualify for that, or for marketplace insurance, so that you can use those VA hospitals if that's your choice, but you have your own portable insurance that travels with you.
Yeah, well, that's good. That's good, because I want to get the information out there, because a lot of veterans are really lost,
right,
as far as what are the different resources that is available to help them.
Well, that's why we have our navigators to help walk through that. And of course, this is a completely free service. There's no charge or anything like this. We all work under a federal grant from the federal government. We work under a grant from the federal government that covers, you know, our salaries and everything to be able to explain that to them. Right. And that's what our role is getting information out about resources available.
Yeah. Well, I'll tell you what, I was involved with a nonprofit organization and involved for veterans.
Right.
And we had a number of veterans that come into our office, and the first thing that come out of their mouth is, "I didn't even know you were even here." And so we got to go through the steps of helping them with the benefits. And what really got me upset one time when I was working with the state, a young veteran just got out of the military, a medical discharge from Fort Polk, and he went to a profit-making organization for his benefits.
Right. See.
And when he came in to the employment office, they directed him to me, and I told him, I said, "What happened?" He said, "Well, I went to this organization and got my benefits." I said, "This is a profit-making organization?" He said, "Yeah." I said, "Don't you realize we do this for free?
That's right.
We're here to help you." And the thing about it is, we're in every parish, but not every veteran know that.
I know. It's hard. Even with Medicaid expansion, you know, we hear the governor talking, we open up the newspaper and we see articles about it, but nowhere is it really talking about what it is.
Right.
And for those that are, for many people, the working poor, that it's free health insurance.
Yeah. Well, I tell you what, this is going to come to our last segment here, so we'll be back in a couple of minutes.
You see, my God, He done shed
We're back with Mr. Bryan, and we could pick up where we left off. I would say that, but however, I'm more focused on the enrollment time.
Sure.
Whether you're a veteran, non-veteran, what would be the best thing?
Well, I think if we're looking at two different things, we're looking at Medicaid expansion and, and Medicaid enrollment in that, or if you're above 138%, like I said, then you're looking at the marketplace. So for Medicaid expansion, that's easy. That's year-round. There is no open enrollment dates, okay? Matter of fact, you can have, if you're scheduled to be in the hospital that morning and you walk in the front door, you can enroll right before you go into it. So it's available anytime. The marketplace is a little bit different. There's only a 90-day window that you're able to enroll, and that begins on November 1st, and it ends on January 30th. Okay. So those are the open enrollment periods. Anytime after that, it takes some type of special enrollment in order to be able to get you in. Say, for example, you got married, or you had a child, or you lost your job, or, certain life-changing circumstances.
Right. Because I know I get notices myself saying enroll. I'm saying it doesn't apply to me. Right. But I've just always been wondering just how many people take advantage.
Well, I'll tell you what.
I mean, they send it out to everybody.
Right. I mean, it's tough. It's hard to get the word out. Like I said, that we think that within Medicaid expansion that there's somewhere between 350,000, 400,000 people in the state. And so far, right now, at about a month and a half, we are at probably about 270,000 that have enrolled in it. Okay. But we still got a long way to go. And, it's through help like you that we can get the word out and that we can make sure that people have access to it and that they know where to come for free help. Yeah, because I know you said you have your office here in Lake Charles. That's right. As well as in Lafayette. That's the major headquarters. We have two offices, one in Lake Charles and one in Lafayette, like you said, but we also have satellite locations. So if you're in Rayne or Crowley or you're up in DeRidder or you're any place throughout the whole state of Louisiana, we've got places that we can meet with you. We've got a total of 9 offices around the state, but we have partnerships with fire departments and with health units and at libraries and wherever people need to go, especially when transportation can be an issue. We will meet with you in your community. Well, the thing is, I know sometimes, as far as veterans are concerned, getting involved with the disabled veterans, right? I think it's the DAV. They do have resources for veterans for vehicle transportation. Right. But some of the DAVs, they're hurting. They are. Because they don't have the money, and they're basically on a volunteer basis. And even though I know, like in the Lafayette area, I think it's the sheriff's office that supplies transportation for veterans. Right. But I wish there was some kind of way where we can help and let the community know where this transportation is. We recognize that need. That's why all of my Navigator staff, they come self-contained with the laptops and the scanners, and they have access to the internet so that they can do the enrollment no matter where they are. And we create these relationships throughout the state, so we have a location. So we try and serve people right there in their community, no matter how small it is. Yeah, I do know when I go, since we're getting a new clinic in Lafayette, okay, that's going to help out a lot as far as transportation is concerned. Because just like next month, I'm supposed to be going to Alexandria, get a little procedure done. But it's 75 miles. And both ways, and I pay for that. That's right, and it's 100 miles if you're here in Lake Charles. So I know our congressman here has been working really hard to get these clinics open and running. And so. Well, the last one I interviewed was with David Vitter. No, David Vitter, and also interviewed with Bustani. Right. Yes. He's been. Both of them are very pro-veteran. He has been a big champion. And also, I'm trying to get an interview with Cassidy right now, Senator Cassidy. But everybody needs to, we need to network with everybody. Well, we could do that. And I'm also getting, hopefully, if it comes up, Secretary Strickland may do an interview for the show. But right now, we're supposed to do it this week, but ever since the storm and the flood and all that came up, he's helping veterans over there and everything else. But it's going to happen. And I do know that your organization is doing something fantastic. Just giving
resources
Look,
to the community.
We appreciate that. And our role is to help these guys, anybody, to sign up and get the resources they need. But it doesn't just stop with that, Mark.
Right.
If you have problems afterwards, we're here to advocate for you. If you're denied charges from your insurance company that you should be, we can advocate for that. If you're having problems with the marketplace or something like that, we're there to help walk you through that. So
we see it's information like that that the average citizen doesn't know anything about, and that includes veterans. I mean, it's
why
everybody.
We appreciate you, and we appreciate your, the Veterans Corner having given us the voice to be able to tell the story.
Yeah, because I know hopefully I'm getting ready to do another interview with SLCC.
Right.
And they said we have other programs there that nobody knows about, so they're going to hopefully we'll start using Veterans Corner to get the word out. And the same thing, I would make that same offer to you.
Okay. Sure.
So as far as I'm concerned, I think we're coming close to the last segment.
Sure.
So thank you, Brian.
Thank you, Mark. I appreciate it and everything.
And make everything happen.
I look forward to working with anybody that you send us. We will help them navigate this process.
All right, my friend. Thank you.
Thank you.
Bye-bye. Thank you for inviting us into your home today. Please spread the word around about the Veterans Corner Show. I'm Greg Gagne. Call me at 315-3259. Thank you, and God bless America.